AM 1220, KHTS, hometownstation.com. This is Dr. Proctor. Every Thursday, noon till 1, we have an opportunity to peek over the shoulders of the medical professionals to learn what it is they're up to and find a way to be even better advocates for ourselves, our well-being, and the people we care about. Today, we're going to talk to Dr. Sai Hassan. He is a pediatric and adult endocrinologist. He has a practice here in Newhall. You can find out more about the practice, if you like, by going to ca.peg. It's actually pegilbert.com, and their phone number is 661-253-4420. Hello, Dr. Hassan. Thank you for joining me again today.
Pleasure to be with you, T.
Today I wanted to talk about a couple of different things. Being an endocrinologist, you cover pretty much everything about the human body that deals with our hormones, and in addition to things like diabetes, which we've spoken about before. I know at some point we're going to sit down and have a conversation about thyroid because it's a real hot button for a lot of people. But we got to chatting a little bit off the air last time about menopause and andropause. And here in the United States, they do talk a lot about something called the silver tsunami. And it's not a matter of if, it's just a matter of when. And it's going to be this slow rolling aging of the American population. And of the two things that seem to come up for pretty much everybody, you can't get away from it, is menopause, and we're going to talk a little bit in the second half of our segment about andropause. Now, menopause, we've heard the ads. It marks the end of a woman's menstrual cycle, and the medical community cites it as pretty much 12 months after cycles have ended, and it really affects every woman. Healthy women in their 40s and 50s. The average age, they tell me, in the United States is 51, but it can also result from medical issues like a hysterectomy, chemotherapy and radiation, or something called primary ovarian insufficiency, which is really affecting about 1% of the population, not a tremendous amount, but this is due to genetic factors or even an autoimmune disease. And this is something that doctors will be right on top of because hormone therapy is recommended for those people until the natural age just to protect brain, heart, and bones. But for the average woman, starting around their 40s and 50s, once they've reached that place of menopause, it seems 51 is the not so magical number.
It is an average, and average, as you know, can be quite different from person to person. There are people who start very early. We have, in our practice, we'll have kids coming in really 16, 17, or 18. They might have some sort of congenital issue that causes them to go into early menopause. And then you have the Guinness Book of World Record talks about a woman in her 60s who was able to conceive. So she obviously was not in menopause. So it can vary quite a bit.
Right, but for the most part, that's kind of the median age. And I know that prior to menopause, we have this thing called perimenopause, which we see it across the board now. We hear it in the ads, we hear it in television and movies, and there are a number of symptoms, but not every woman experiences every symptom.
That's exactly right. Symptoms can be quite varied, and nowadays there is a greater awareness, and we see it on TV all the time. And as you mentioned, silver tsunami, and people are just more aware. We've got the internet, and so it's opened up a whole new world for most people. In the past, of course, women dealt with it, because their mothers dealt with it, and quietly.
Yeah. Now it's, you don't have to suffer in silence. There's things you can do. While there the treatment of it might be a little controversial, and we'll get into that in a little bit. There are things you can do for the symptoms.
Exactly
certainly.
Right, and to be aware of the symptoms and to know that you can actually deal with them in different ways. It's not always medical, by the way.
Well, I know one of the first things that most women will talk about, the very first one that falls off the tongue is the hot flashes, That's
hot flashes.
Night sweats.
Night sweats is common. Some people have night sweats without having hot flashes. So if somebody's literally soaking their sheets overnight and waking up maybe exhausted, maybe not having a good night's sleep, and they notice that they were sweating overnight, but they don't really piece it together. So a few people, turns out, will have this night sweat without the hot flashes, and so it can be missed. But when you get to that age, like you said, around 51, just a greater awareness and talking to your doctor more about how you're feeling, how the body's changing.
I think, honestly, everything I've ever read about going in to see your doctor seems to be there seems to be a cheerleading squad for journaling. If someone, when you go to your doctor, if you had a journal that gave some idea of how you live, how you eat, what you do, what you're feeling, it seems like that every single thing I read about, whatever medical issue it is, that comes up first and foremost. Have the conversation with your doctor, but know yourself.
Know yourself, and make sure you do keep a journal. And I love it when people bring in either notes or questions that they've thought about.
It helps you.
It helps me immensely.
I know that along with menopause, one of the other things is discussed quite a bit, you hear it in the media all the time, is mood changes, weight gain, and the slowed metabolism, thinning hair, dry skin, there's vaginal dryness, irregular cycles, but a lot of women, even that not everybody experiences that. Some people will have their cycle right on up till the point of, or skip 2-4 months. I mean, it's really hard for women to know. And what's even scarier is that there's still a possibility that, pregnancy is an issue because you're not, 1 month, 2 months, that's an interesting thought.
It can happen. There are people who get pregnant in their 40s and 50s. We hear that all the time.
I'm just so surprised because I just didn't think that was going to be a thing that you had to worry about. It's like, oh wait, one more problem is that you might have that too.
Well, that and there are things that are internal that people should be aware about. Women, because of estrogen, are protected compared to men for heart disease. But
when that starts to drop,
when the estrogen starts to drop, you're at greater risk for heart disease. And because women rely on more estrogen than men do, their bones begin to start to change. So
osteoporosis becomes an issue?
Osteoporosis becomes an issue, and it takes a long time. And it's a perfect storm sort of thing. It's not just a lack of hormone, but if somebody isn't eating right, eating healthy, being aware of diet and exercise, then they're at even more risk.
And that simple weight gain that can come with perimenopause, menopause is really hard on the body.
It's definitely hard on the body. So you have to be prepared and just be aware, and then know that metabolism in men and women dramatically drops in the 40s.
It just seems like it's so wrong. You lose so many other things, and now that's going to go too. It's like, it's just menopause is one of the things that it seems to be the bane of a lot of people's existence, and not even, I don't even know so much that we concentrate on the issues like the cardiovascular disease, osteoporosis, but we have a lot of issues with the symptoms, but there are things we can do for that. Now, for the most part, when a woman might suspect that this is something that's going on with her, the symptoms are usually enough for you and your diagnostic skills to see and say, this is probably what's happening. But are there tests?
Yeah, we do tests, and just based on routine visits, and we, of course, test different things depending on the age of the person. So, if somebody's in that age range, being 51 or even a little bit earlier sometimes, if there's a family history of early menopause, then we will begin to do the tests and then start to prepare people. Hey, your tests have come back. The hormones from above the ovaries, from the pituitary, start to rise as we go into menopause or male version of menopause.
Now, some of the symptoms that are associated with menopause is one of the tests you might think of to do first as a physician is the thyroid, the TSH, so that they can figure out which is which.
Exactly.
Because they mimic, right? A lot of thyroid things.
Exactly. So we check thyroid. It turns out thyroid is common at that age also. So typically, in a visit for a person, we'll check both thyroid and we'll check for markers for menopause.
Now, I know one test, they talk about the FSH. Can you talk to me?
FSH is a hormone that's released from the pituitary gland, along with the LH, which also is released as our ovaries or testes with age aren't working as effectively.
So these are both blood tests for the most part, is
Blood
what
tests.
you would do?
It turns out there's a commercial test available. It's a urine test, and you can get it over the counter, and it's a way you can check for whether you're slipping into menopause or male version
An
of
over the
menopause.
counter you can get at the drugstore?
You can get at the drugstore. It turns out that the urine pregnancy test, that's a marker that, of course, people can get over the counter.
Right.
That marker that's tested for pregnancy is very similar to the marker that you described, FSH.
Oh, see, now I didn't know that. And so when you go to your local drugstore and you say, I want to pick up this test, and you take that home, and so now you know. So now you have the idea that, oh, doggone it, here I am. I've hit that place that we were at. There's really nothing you can do to prevent it. It's going to happen. But treatment is kind of, I know that they talk about a few things that it helps mostly with the symptoms. You can't really treat or you can reverse it, like we talked about at the very beginning, someone who perhaps has the primary ovarian insufficiency, they'll be treated because they really want to ward off some of those other big problems.
That's right. So we have an entire host of different treatments, and some of the things that people have been doing throughout their life, just being aware, eating right, and exercising, that can go a long way.
You know, that is a familiar theme. We hear that a lot with just about everything that could possibly come down the waterway as you age, as you continue to draw breath, is exercise and your diet, because those two things seem to be so critical with everything, and that can even help with some of the symptoms. But now here you are, you're woman, you've taken the test, you've confirmed, here I am, and what do I do about this? But for example, the healthy diet and the slowed metabolism, how does a woman approach that, where she says, all right, for the most part, I eat really well, I've done things, but still putting on weight, is it jacking up that exercise routine, adding a little cardio? What are like the primary things she could do to help herself?
By the time people have done those things and they're still frustrated, then we start to dig into other tools in the box, and we look at different blood tests. We'll take a look at an estrogen level. We'll take a look at a progesterone level. We'll look at testosterone level. All of these hormones are made in the pituitary and in the ovaries and testes, and we can assess if these are extremely low.
Now, as endocrinologist, you have the big map. Sometimes I like to think that other doctors, they will take the test or they will treat something and they'll have a basic directions for how to get somewhere. They have a general GPS. But I always think as an endocrinologist, when you sit down and you look at the big graph of the human blood typing, and you start to look at everything that's there, you'll start to see things, and so you treat it really from that granular level.
The best way to look at it, and we talk about this with our students that rotate at our office, is that talk to the patient, get a history, find out what they're feeling. If there's a family history, for example, of bone disease, then we've got to focus on the bones.
On the bones, yeah.
If there's a libido issue, then we deal with testosterone. If it's a heart disease that runs in the family, we think about estradiol. So focusing on what the complaint is, and then going after the blood test that will only confirm the suspicion as to what may be going wrong.
And which checks and balances need to be dealt with. I know there are some things to do you can do to relieve the symptoms of menopause. Hormone therapy certainly is a possibility, and as you were saying, the estrogen cream, tablet or ring. I know some doctors have even talked about like low dose antidepressants because of the mood shifts and that real cloud that hangs over. And
there are some antidepressants and there's only one that's been approved. We can use that, but we use estrogen. We can use progesterone or testosterone. We tend to favor the creams or the patches so that you don't get this first pass through the liver taking it orally. It turns out that
that's a bit harder on the body.
It's harder on the body, and they had been using in lots and lots of women and found, unfortunately, higher risk of heart disease and higher risk of cancer because of using estrogen given orally.
So you have to consider all of that. The osteoporosis medications that deal with the bone issues, what kind of things start out like at a very conservative level?
If we are only worried about bones, if there is a family history, or if the person's suffering a fracture, or if the bone density is low, we check bone density, which is basically a fancy X-ray. Then the most
the fancy X-ray. I like that. Is that the technical term?
That's a technical term. That's right.
The fancy X-ray. But so you look and see what exactly is going on, and then how do you treat that, even at the lowest of level?
Yeah, I know I sound like a broken record, but diet and exercise.
Yeah,
again.
no, you can't say it enough. I think that the more you hear it, the more we're prone to maybe listen.
Yeah, I do that in my office a lot, and people who listen really benefit. So we talk about calcium. A lot of people don't drink enough milk, and you have to consider you get calcium from green leafy vegetables. So without even trying, we're getting about a third of the required calcium, and then the other 2/3 we've got to get in the form of milk or cheese or yogurt, those things.
I used to think dark leafy vegetables just had a really good publicist. It's like, what? Everywhere I go, I'm being pushed to do that. But really, the benefits are so great to us. What about things like any kind of supplements, like vitamin D or some of the...
Yeah, vitamin D is becoming more and more popular. It's turning out that people aren't getting enough vitamin D in their diet. A lot of people who work indoors or who put on a lot of sunblock to prevent the sun helps us to form our own vitamin D.
And also, I've read a little bit about how low levels of vitamin D can even lean a person toward depression. That if you're not getting enough, that maybe that's part of it.
Yeah, there's some evidence there that it also fights against cancer. That it also fights against heart disease, the immune system. I haven't heard depression, but it's something that we obviously need to have higher levels in our body.
And that exercise that you talked about, and because menopause, one of the hot buttons is, mood swings or, mood changes. Exercise is one of the things that helps the brain sort of generate all those feel-good hormones that help with that too.
And one of the issues that happens with menopause and the male menopause is you start to reduce growth hormone in your system, and growth hormone turns out is something that athletes use.
Right.
Some of the doping scandals, they use growth hormone, and as we get older, our own body level of growth hormone goes down. And guess what can naturally increase your growth hormone levels is exercise.
Dun, 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 dun. Imagine that, right? And I've read, I don't know a lot about this, so I'm gonna defer to you. One of the things they've mentioned in treatment for symptoms of menopause was something like gabapentin or Neurontin. What is that the benefit for?
That's right. So you can wind up having some aches and pains that associated with the normal aging process.
And now we all heard that. I remember that was one of the things when I was growing up. Commercials would talk about the aches and pains of just getting older, and so that's one of the things they can do to
That is one of the things. And if I'm remembering what you remember, is Geritol.
Yeah. Iron poor blood, aches and pains.
Exactly.
And I remember family members just getting up going, oh, just everything sort of hurts. It's like, wait, does that happen to everybody? Oh, apparently so, yeah.
Yes.
So now we're going to blame menopause. I think menopause could be the bad guy to take that.
Well, you can blame hormones.
The decreasing hormones that come along with age. And in the next segment, we are going to talk about something called andropause. You may have heard it called male menopause, and sometimes testosterone deficiency syndrome, androgen deficiency, and late onset male hypogonadism. We're going to talk about that in just a little bit. We're chatting with Dr. Sai Hassan. He is a pediatric and adult endocrinologist. He has a practice here in the Newhall area, and they are located on Peachland Avenue. If you would like to learn more, or you're saying to yourself, either myself or someone I care about is going through a lot of these symptoms and could maybe be helped by seeing their physician. Again, cannot emphasize enough, we discuss it over and over again about exercise and health. You're listening to Dr. Proctor here on your hometown station, AM 1220 KHTS.